Hello everyone, you are watching Shooting Up in the Dark, where we discuss addiction, opioids, and chronic pain. This short segment is about the interface between addiction, pain, and the U.S. healthcare system. In the earlier stages of this project, Shooting Up in the Dark, my intent was to focus solely on drug addiction. But as a physician, I saw how the gap in knowledge about addiction among doctors, healthcare professionals, patients, and the public in general, how this misunderstanding or ignorance extended to treatment with opioids, opioid dynamics, and appropriate approaches to chronic pain. I realized how intertwined these phenomena are in people's thinking and in how they play out in real lives. People with addiction are generally not treated well in our system, and people with chronic pain, most of whom are neither addicted or at high risk for addiction, are being mistreated also, labeled as addicts, and today often abruptly cut off from their medications. Inappropriate denial of opioid therapy to patients with chronic pain paradoxically can cause addiction to illicit drugs. And people with influence and power over medical professionals are blind to this fact. I've witnessed this and heard about it repeatedly in stories of addicts. Other videos will reveal the details of how this tragedy is becoming more common. Before my experiences with chronic pain and addiction, as a doctor, my approach to all of this was based in assumptions and ignorance. I considered people addicts, addicted to their pain medication, when in fact, they were just demonstrating dependence on their medication, which is normal, or were exhibiting tolerance after years of therapy and needed dose increases. I remember feeling frustrated at what we doctors used to call medication-seeking, quote-unquote, or chronic opioid users, when the real source of frustration was that I didn't know how to safely prescribe opioids and monitor use. I felt that I couldn't help these patients, and as the anti-opioid sentiment grew over the last decade, the clear message underlying new recommendations and warnings was that opioids are detrimental to people, period. The, quote, opioid epidemic and reactions and consequences to it are discussed in some other videos on this channel. I remember feeling anxious about seeing patients who needed refills on long-term opioids, worried that maybe they were an addict, maybe they were taking advantage of me, when really my anxiety was about using opioids as a therapeutic tool without understanding how to distinguish when it was good for the patient and when it might be harmful. In the back of my mind, I'd wonder if I was causing people to become addicts and felt conflicted. This makes perfect sense because I couldn't wrap my head around what addiction was exactly. And if they did become addicted, I had absolutely no idea how to help these patients. Many physicians today think and feel this way, conflicted. The pressure to not prescribe opioids is now so intense that healthcare providers resolve this conflict by a practice-wide policy to not prescribe opioids, and in some cases, any controlled substances at all. I also assumed that people who didn't fit my mental stereotype of an addict were not addicted, when in some cases they were. I tended to distinguish between alcoholism and drug addiction, when alcohol, in fact, is a drug, and addiction to it looks just like addiction to other drugs. The abuse of an addiction to alcohol are socially accepted, often not recognized early enough. I at one point believed that people got addicted to drugs because they liked to party and had no restraint, where in most cases the opposite was the case. People were abusing drugs to cope with deep pain. I was so arrogant as to believe that I, John, a husband, father, physician, healer, and I liked to think a person of faith, integrity, and principle, was beyond being affected by addiction. I certainly didn't respect addiction for the complex, cunning, deeply human, and potent mental disorder or disease that it really is, nor how susceptible anyone could be to it. So while writing and researching, I realized that to gain a clear overall perspective on opioids, drug addiction in general, and chronic pain treatment, that the misunderstanding and ignorance about all three must be addressed. This is why Shooting Up in the Dark focuses on dealing with drug addiction, but extends the discussion to related problems in our healthcare system, to what frankly is the abandonment of chronic pain patients, to the role of opioid treatment, and how it can be performed judiciously and safely, while still recognizing each patient as an individual. Today's healthcare climate around opioids, pain, and addiction is characterized by fear. Doctors, under scrutiny and potential discipline if they prescribe chronic opioids, are deciding to simply no longer deal with chronic pain medication, leaving patients suddenly without their medication and subject to acute withdrawal. A similar phenomenon is happening with anxiety medications, benzodiazepines, which are also very, very difficult and often dangerous to withdraw from. The serious consequences of abruptly stopping these medications are not yet widely recognized by healthcare professionals or by the regulatory bodies which create and enforce new rules around prescribing. And there is political momentum behind the idea that limiting or stopping these medications wherever possible is a solution, or the solution. This is a very narrow-minded and, I believe, mistaken idea. Some patterns of prescribing, most notably around acute pain, were excessive in the past, and this has changed. When it comes to long-term or chronic pain, however, there are individual differences regarding the medication dose any particular patient may need, and this can vary widely. Yet doctors are being told they must apply the same conservative standards to everyone. Related healthcare policy is not being driven by sound medical science or by healthy communication between doctor and patient, but by fear and reactivity. Medicine is a science and an art, but it is becoming more and more impersonal and protocol-driven. When I speak about substance addiction, unless otherwise indicated, the information given applies to problems with any drug or substance. My personal experience with addiction when I was addicted was centered around opioids, and while I do speak specifically about opioids as a great example of drug addiction, what we discuss in the videos applies to other drugs as well, including the most widely abused drug, alcohol. Opioids, alcohol, and benzodiazepines are somewhat distinct in that they each can result in dangerous or even deadly physical withdrawal because they all cause physical dependence. The experience of withdrawal can be just as hellacious, however, for most other drugs. Stimulants, be they prescribed like Ritalin, or illicit like in methamphetamine or cocaine, have a different typical withdrawal syndrome characterized by crashing for days after a binge, during which one is not very functional, spent physically, mentally, and emotionally. During a binge, addicts or abusers can become aggressive, delusional, or paranoid. The specific effects are different from other drugs, but the impairment and consequences are often the same, regardless of the drug one is addicted to. And this extends to marijuana, ecstasy, hallucinogens, designer drugs, etc. What is similar is the addiction. The experience or condition of addiction arises under similar circumstances, has similar roots, and, quote, helps the person at first or seems like a solution, is valued and craved highly, and eventually to the exclusion of all else, regardless of the drug or chemical. It's not the drug which is the problem, it is the mental, emotional, and behavioral dynamics of addiction. It is the addictive relationship an individual forms with the drug. Detoxing from different drugs is a different experience depending on the drug. Still, successful detox requires support and often is best done in formal treatment settings. One treatment center can handle cases of addiction to different substances because the patterns and consequences of being caught up in addiction are similar regardless of the drug. And ongoing treatment and recovery are based on the same principles. It's about treating the addiction, which can manifest in many forms, not so much about the specific drug. In terms of medical aspects of detox, a professional should always be consulted to help design a safe plan. If the roots of addiction are not dealt with, addiction can change faces. It's not uncommon for a person who is addicted to amphetamines, for example, if not staying present and focused on their recovery, to down the line become addicted to alcohol or another drug. And of course, there are the behavioral addictions too. The key point is that once the substance or substances are out of the body, dealing with addiction's nature, patterns, and effects is the real healing, similar for everyone. Recovery is available to anyone, regardless of addiction's focus. and relapse back to the original drug or a different one is the rule rather than the exception, unless one is actively engaged in their recovery. One can be addicted to relatively benign substances such as nicotine, caffeine, or chocolate. The difference is that the risks and consequences of the addiction are less dramatic and often do not cause serious impairment or alter one's life course as radically as, say, cocaine or fentanyl can. In the cycle of addiction, emotional and mental pain are what prompts the craving or need for escape, an alteration in perception of pain. The drug or medication, assuming it works, and for those prone to addiction, it seems to work miraculously, is then the quote savior or the quote missing piece. In the beginning, opioids made me feel okay. Something that was haunting me and causing suffering was gone, pushed to the background. As time moves forward, the solution perceived with drug use fades. And if really addicted, then sooner or later the focus on obtaining, using, and in greater quantity becomes obsessive and causes consequences. Many of these consequences are painful, by which I mean unsettling, overwhelming, associated with fault, which produces shame and blame, self-contempt. These feelings are unmanageable too, driving more pain and even more intense craving for more relief and therefore more drug. Addiction is always about more, but is never enough. Shooting Up in the Dark, the title of my book manuscript, is an image of living in the pain of addiction, lost and alone. Thus, it is also the title of the video series. So while most of the content on this channel addresses addiction and recovery, those who are dealing with the healthcare system and chronic pain will also find relevant discussions. I believe that change is needed in all of these areas and that each impacts the other. As I make new segments, your questions and feedback will be my guide, so please tell me what future content you would like. Thank you for your interest and feedback. See you again soon.